picking up nowadays on pregnancy. So here it's one of the very important trending topics. What is there nowadays is about the NTNB. So the NTNB scan, what is being done, it is basically more involving it is mostly done in the first trimester, and the gynecologist and the healthcare provider can make such routine investigations to rule out certain abnormalities. So basically the NTNB scan, basically in this video I'll be mainly talking of what is about this NT scan and how it is done. So NT, the word NT, itself refers to the nuchal translucency. Means how is the nuchal, what is the, how is the translucent area just this behind the neck of the fetus, it is visualized, and it is being checked that whether any kind of anomalies or abnormalities of genetic origin or chromosomal origins can is present in the newborn, is present in the unborn baby or not. So what it is there, it is, so firstly the NT scan, that is the nuchal translucency scan, it is mostly done during the first trimester, and that too during the period of 11 to 13 weeks of gestation. So at this time what it is there is, firstly we need to understand what does the word nuchal means. So nuchal, it refers to the neck region, and when the fetus is in the womb of the mother, it's actually the neck area which is having certain kinds of folds over there, and these folds are going to contain a certain amount of a fluid is there. So a small amount of fluid is quite normal, but in certain conditions if the amount of the fluid is too much, so that can be an indicator of certain kinds of chromosomal or genetic variant abnormalities. And apart from this, including this, it can also, if there is an abnormal amount of fluid in the nuchal fold area of the fetus, this can also be an indicator that there can be an increased risk of the congenital heart defects in the newborn baby. So it's just to rule out these anomalies during the first trimester only the scan is being carried out. And another very important question what is being that can be asked is that why it is at this time only, that during the 11 to 13 weeks of gestation only, why the nuchal scan is being conducted. So actually it is during the first trimester, that is between the period of 11 to 13 weeks, there is an appropriate small amount of fluid is quite normal during the nuchal folds what are formed in the neck region of the unborn baby. And as the pregnancy progresses, after 14 weeks, this fluid is being absorbed by the neck region. So this fluid slowly gets absorbed by the baby's body, and in that time, after 14 weeks of gestation, this nuchal translucency scan is practically impossible to carry out because of the lesser amount of the fluid what is retained there. So it is mostly done, the fluid is mostly reabsorbed after 14 weeks of gestation, and thus it making it harder for performing the NT measurements. So just in this scan what it is done is that the nuchal folds, that is the fold what is formed in the baby's neck region, the amount of the fluid, some amount of fluid is normal, but if there is an increased in size, just by measuring the size of the fluid, that the translucency size, if it is going to increase in certain conditions, so mostly that can be a predictor of certain genetic abnormalities such as Down syndrome and Edwards syndrome, or it can be either Patau syndrome. So Down syndrome is a condition which is very frequently, it has been stated in the demographic data of the US that 1 in 700 newborn births, one is going to suffer from Down syndrome. So just to rule out such anomalies, this nuchal translucency scan is being carried out, and a higher measurement of such a radiolucency, that translucency what is there, if it is a higher measurement, that can also indicate certain congenital heart defects. So I've already said that it is being carried out during the 11 to 13 weeks of gestation, and that too the healthcare provider is only going to ask the pregnant mother to get the scan conducted when the crown rump size, that is the head of the fetus, from the crown top of the head of the fetus to the rump, that is the to the foot toe, that is the bottom of their torso. If it is measured, the measurement of the crown rump length should lie approximately between 45 mm to 84 mm of the crown rump length. So at this time, the healthcare provider can ask for an this NT scan, and this can rule out certain anomalies. So this is quite a normal thing. And how it is being carried out, mostly it is seen that just the pregnant expecting mothers, when they go for the ultrasonography, they are supposed to wear loose clothes, so that the healthcare provider is going to examine your lower abdomen, and so firstly they are going to apply a certain amount of a gel on the lower abdomen, and with the help of a van, with the help of a transducer, they are going to palpate that lower abdominal region for uh, the conducting this scan. And apart from this, what it is saying that mostly the mothers, the expecting mothers who are going, they need to come with a full bladder, because they did not they are supposed to at least drink water and retain that water during in their your bladder. Their bladder should be full, just because to have a better visualization of the scan. So this helps in good visualization. And in concluding, so this in this way, in this video, and I've tried a simple I've tried my level best to simplify as to how what is the nuchal translucency scan and why it is being carried out. And apart from this scan is an optional scan. Some mothers, they do skip this scan and they don't prefer going for the scan. But and at last I would say that this NT scan is nothing to worry about. It is a very easy and a non-invasive scan, and since it is so easy to be carried out, it is neither going to harm the baby in any way. So it is preferably a very safe ultrasonography procedure. Either it can be done through the abdominal side, or the transducer can be either, in some cases it can be through the vaginal ultrasonography. This NT scan can be carried out. So expecting mothers, lactating mothers, I would suggest that you consult your healthcare provider for this, any kind of doubts if it is there. And I must say that there is nothing to worry about. It is quite a non-invasive method, and it is not going to harm in any way, neither to you or not to your baby in any way. It's very easier, and it won't cause any harm. So if you still have any queries or comments, you're most welcome to comment me in the comment section. And viewers who are new to my channel, they haven't subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.